Welcome back, and thanks for joining us today. So last week we started talking about wrist pain, and I mentioned something called carpal tunnel syndrome. That afflicts a lot of people in the US and even in the world, especially since we have often a sedentary lifestyle or work position where we're at a computer all day. The problem with this position is our wrist is pulled and the muscles right here and the tendons all throughout the bottom of the forearm here get used to pulling and working abnormally, and we have a nerve that goes right down our wrist and under this tunnel called the retinaculum covers that tunnel, and the nerve that goes into your hand goes right here. So if anything compresses on that nerve, then you get symptoms of numbness and tingling on your thumb, the first finger, second finger, and then half of your third finger is typical. You'll also see a wasting away of the muscles right here, and they call it your thenar eminence, right at the base of your thumb. And you may notice that your grip strength is not as strong. So what happens is the muscle gets compressed. If it's true carpal tunnel syndrome, we say that the compression happens right here at the wrist. But sometimes, and actually quite often, I find that there is compression somewhere along the line, not just only at the wrist. So some people eventually end up getting surgery, and some people choose to do surgery right away because they have symptoms and they can't get any relief. But sometimes, if you want to address it non-surgically, you can look at various areas where you have nerve compression. It can be right here in the neck, sometimes right here in the pecs at your brachial plexus, sometimes right here at the median nerve at the elbow, and then even again at the wrist. Now, we've talked about how muscles can tighten up in your forearm and compress and pull on your tendons to create pain in your wrist joints. But if those muscles are tight in your forearm, they can compress and pull and decrease the space available for your nerve as well, leading to the carpal tunnel syndrome. This can also happen in your upper arm too, because your median nerve goes down in your upper arm, and so if there are muscles here that are extremely tight, it can compress and decrease some of the space available for that nerve as it goes through the front of your elbow. Again, it can also happen at your pecs, and even it can be some compression in your neck where the nerve root exits down here and as it's coming down. So things to consider is not only should you be looking at the muscles throughout your arm, but again, as I've mentioned on many of my previous videos, we need to look at the rib cage position, your chest position, how tight your pecs are your ribs down and in neutral, because that affects everything all the way into your fingertips. So before you decide to go get surgery, make sure you exhaust your options if that's something you want and you want to avoid surgery. We've helped many people get rid of the carpal tunnel syndromes just by changing their body position, learning how to breathe differently to relax their nervous system so the muscles calm down and release in their arms, free up the joints, free up the space, free up your symptoms. I hope this helps with you. If you have any questions, please contact me at amy@pabertinstitute.com. I'd love to hear from you, and if you have other ideas for videos, please share them and I will add them to the list. Thanks. Bye.